Hi, good morning. This is Dr. Yun Han Kim. I'm a functional nomad, and today I want to talk about low dose naltrexone or LDN. As an integrative medicine and functional medicine and lifestyle medicine physician, I don't really like using medications. And when a lot of times my patients will ask for primary care prescriptions, and I'll just tell them, please approach your primary care because um, I don't prescribe those kind of medications. And a lot of times, I don't really believe in them. And I think if there's a better way, we should do a better way. Now, there are other times that I do believe in medications, so I'm not anti prescription meds, but I'm not automatically pro supplement either. So I want to be mindful and do the right thing for my patients. So low dose naltrexone is an amazing tool in integrative and functional medicine practice because the there's a in integrative medicine we have this idea of adaptogen, and adaptogen means almost like magic, that things that bring a system into balance. Adaptogen is something that brings a system into balance. So for example, if there was an immune adaptogen, then it would bring immune system into balance, which means that it can be used for hyperimmunity like allergy or autoimmune disease, or like cancer, which is underimmunity or hypoimmunity. So sounds like magic, doesn't it? And the thing is that low dose naltrexone does seem to do that. And how I heard about low dose naltrexone was not in medical school, was not in one of the two residencies, and it was not in one of the two fellowships I did. Um, After medical school, we have internship, and then we have residency, and then after residency, we have fellowship. So I think I may be overtrained, but sometimes I feel barely adequate to handle complexity of the patient. So how did I learn about LDN? Well, my patient came to me. Patients are amazing. If you just listen to them and you're curious and genuinely love them and want to serve them, then they become like the greatest source of wisdom in the collective hive mind, ultimate. So one of the patients about 20 years ago said, Dr. Kim, I did some research. I found something interesting. Do you mind doing more research? And then maybe prescribe it for me. Well, so I did a lot of research, about 2 weeks worth of research every night, go home, research. If I had any free time, do research, do research, do research. So what happened is that I couldn't see any bad effects of letting the person have access to LDN. They're all the positive things. So this person had hypothyroidism. And lo and behold, this person's hypothyroidism got better. And this is after me treating patients with inflammatory protocol that I learned from a fellow integrative medicine fellowship, and it didn't do anything. But now with LDN, I could reverse some of the Hashimoto's thyroiditis as well as some of the other conditions, such as other autoimmune conditions. So today, I have patients that I've seen. The rheumatologists have declared that patients are in remission from rheumatoid arthritis, psoriatic arthritis, um, and other physicians have declared psoriasis, or a neurologist would declare that patient no longer has MS. So one of the things that I try to do is I practice with collaboratively with a specialist because I'm not a specialist in their field. So I'm very careful about collaborating with them. Um, and so these are their specialists deciding that they no longer need those medications and they take them out of medication. So LDN can help to normalize immune system, which is fantastic. The second thing that I use naltrexone LDN is that it is a modulator of inflammatory system within the nervous system called glial cells. And this is done by what we call toll-like 4 receptor inhibitor. And it, it it's not the probably the most powerful, but it's really effective. So anything involving nervous system, such as nerve pain, we call that neuropathy, LDN can help. And other things that if you have just inflammation of the brain, LDN can help. As a matter of fact, tinnitus, if it is due to inflammation of auditory nerve, LDN can help. So LDN can even help you to grow hair if autoimmune is the issue, like the um, hair loss due to autoimmune condition or vitiligo. It can not reverse it, but it can stop the further progression. So LDN in my toolbox, um, I do two things with it. If I want to modulate the immune system or calm it down, I use LDN. If I want to calm down the nervous system, I use LDN. So there are many things that we can do for LDN, and I've recently created a support group because we had a great support group run by Brian Haviland, and it got banned it got banned. So I am just by Facebook. So I created another one. Of course, I created one. I got banned right away, but luckily they let me back in, and I think I know what happened. So I'm going to keep the new group very dry, if you will, just question and answers, and not create a lot of potential waves, and hopefully that will do it. I just want to serve, and I want other people to benefit from this lost medicine. Oh, the third interesting thing about LDN is it can help with patients with cancer, and that we'll talk about it another time. Thank you. This is Dr. Yunhan Kim. I'm a functional nomad. Thank you. Have a great day.